Alright, team, listen up. The patient is exhibiting symptoms of labyrinthitis, post-vaccinal encephalitis, and omositis. What do we think we're dealing with here?
Could it be a case of vestibular neuritis due to labyrinthitis?
I'm leaning towards an immune response causing post-vaccinal encephalitis.
I've seen similar symptoms in patients with omositis. It could be the culprit.
Wait, what about Sal-Greenstein syndrome? It's a rare condition that presents with a combination of those symptoms.
You're onto something, Frank. It is indeed Sale-Greenstein syndrome. We have to act fast.
But doctor, that procedure is extremely risky. Are you sure it's the right call?
Damn it, Gary. I didn't spend years in medical school to second guess myself. Trust me, this is our best shot at saving the patient.
Now scrub in, all of you. We have a life to save.
Tracy, thanks for fitting me in. I need to talk to you about my patient with the symptoms of Sale-Greenstein syndrome.
Hawks, I have some concerns about your diagnosis. Are you sure it's Sale-Greenstein syndrome?
I've been in the field for over 20 years, Tracy. I know what I'm doing.
I understand your expertise, Hawks, but let's not forget your track record of misdiagnoses. We can't afford any mistakes.
This time is different, Tracy. I have a gut feeling about this patient, and the pull-through procedure is our best shot at a proper diagnosis.
I'm all for trusting your instincts, Hawks, but remember the consequences of being wrong. Let's proceed cautiously.
I hear your concerns, Tracy, but I truly believe this is the right course of action. Trust me on this one.
Leslie, I just checked on the patient and it's not looking good. I think the pull-through procedure was a mistake for Sale-Greenstein syndrome.
Oh no, that's terrible news. We need to act fast to save the patient.
I know, but I'm worried about how Hawks will react when he finds out.
Forget about Hawks for now, Frank. Our priority is the patient's well-being. Let's focus on what we can do to help.
You're right. We have to do everything we can to stabilize the patient.
Let's get to work.
What were you thinking? You almost killed the patient with that wrong pull-through procedure and misdiagnosis.
We thought it was the best course of action based on the symptoms.
Well, we can't all be perfect diagnosticians like you, Hawks.
Maybe we should reconsider the symptoms and reevaluate the diagnosis.
It's not like we did it on purpose. Mistakes happen.
Mistakes that could cost someone's life. You all need to get your act together. I'm surrounded by incompetence.
Let's try to focus on the correct diagnosis now.
I still think it could be a case of intestinal obstruction.
I'm leaning towards a severe case of food poisoning.
What about a parasitic infection causing the complications?
You're all clueless. I can't work with such incompetence. Figure it out yourselves.
Well, that didn't go well.
Let's put our heads together and try to solve this without Hawks.
Agreed. Let's not make any more mistakes.
We need to prove we can handle this without him.
I can't stop thinking about this case, Johnson. It's like a puzzle that I need to solve.
Well, you always do. But what about you? How's everything outside of these hospital walls?
Honestly, I haven't had time to think about anything else. This patient's symptoms are just so unique.
You need to take a break and focus on yourself sometimes, you know?
I've got it. Johnson, I have to go.
Wait, what? You can't just leave like that. What about our lunch?
Sorry, Johnson. Duty calls. I'll fill you in later. Thanks for listening.
I guess I'll just finish my lunch alone then. Good luck with your patient, Hawks.
Storms into the room.
What are you doing? You can't just come in here without proper gear.
You're putting all of us at risk, Hawks. This is unacceptable.
Ignores their comments?
Hawks, we need you to follow protocol. It's for everyone's safety.
Sale-Greenstein syndrome doesn't fit the symptoms. It's viral load.
Viral load? What's the prognosis, Hawks?
Prognosis for viral load is not good. It's aggressive and spreads fast.
We need to act quickly then. Let's get containment measures in place.
Tracy, I finally figured out the right diagnosis for the patient.
That's great news, Hawks. Well done on getting it right.
If only I didn't have to deal with such idiotic doctors, this whole ordeal could have been avoided.
What do you mean by that, Hawks? You were the one who initially made the wrong diagnosis.
Well, my diagnostics team clearly failed to catch the mistake.
Hawks, don't try to shift the blame. You made the wrong call. Own up to it.
stands up abruptly. I'm done here.
Sighs as Hawks leaves the office.